So I'm here with Dr. Zadkoy. I'm just going to have Dr. Zadkoy introduce himself, tell what he does and where his facility is and how you can contact him if you're interested in coming in to see him.
Hi, I'm Dr. Steven Zadkoy. I've been a chiropractor and applied kinesiologist and a nutritionist for 31 years. I practice in Freehold, New Jersey, and my telephone number is 732-308-0099.
Terrific. So Doc, wanted to talk a little bit about pain. One of the things you specialize in is pain management, chronic pain cases, fibromyalgia. How does your approach differ, let's say, from the average run-of-the-mill, medical system model where they're always treating, the source of the pain, right? There's a famous expression: he who follows the pain is lost, right? So a lot of the time, pain is quite advanced and can be very, obviously, neurological. But what's your approach, and what do people need to understand about different approaches to pain management?
So unfortunately, we've become a let's treat the symptom society. Your shoulder hurts, get an injection. You have stiffness and achiness, take a pill. You're angry, take a pill. You're depressed, go see a therapist, take a pill. And nobody is really looking for the underlying causes of problems. So a lot of times when patients come into us, they bring a file this thick, and the average person, I've seen 8 different doctors, I've had 6 different injections. I've had one lady who's had 32 injections for her back, and they're looking for something different. The problem with our society is we should actually try the stuff that's different first, because it's much more cost effective, much more efficient. But because our society and medicine is based on money, people go for the fancy and expensive. So in my office, we look at a patient from 3 different avenues. What's the physical cause of the pain? What's the emotional component to the pain? And what's the biochemical, nutritional component to the pain? And if you just have a frozen shoulder, it may be 95% structural and 3% inflammation from biochemical and 2% emotional because you're upset about working out. But a lot of times, like you take fibromyalgia, we have a lot of fibromyalgia patients. Those are patients who just have chronic pain in their muscles and joints all the time for no particular reason. And after treating this for 30 years, before it was actually even a true disease by the medical society, I've been treating fibromyalgia patients. And if you ask every fibromyalgia patient a couple of questions, one of them is, what was the big traumatic event that triggered this, 6 months or a year before this? There's always something. Yeah. Someone died. There was some personal trauma. Correct. There was a car accident. There was an event that sent their nervous system over the edge. Yes.
And that's all autoimmune diseases. They've shown that all autoimmune diseases, most people can trace it back to the exact day that they started to feel the symptoms of their autoimmune disease. To your point, it's an emotional reaction in all autoimmune diseases.
Right, so when we want to treat a fibromyalgia patient, yes, we want to do some structural stuff to relax the muscles and reduce the inflammation. We want to use some nutritional products to bring down the inflammation and strengthen the body. But I also do a technique called neural-emotional technique and use nutritional supplements to help with the brain chemistry. Right. Because when you change the way people think, and with the way the brain brings in stress and manages stress, all of a sudden the inflammation starts to reduce, the pain starts to reduce, and people start to feel better. Whereas when you try to get an injection into each of these joints or just take a pill to get rid of the inflammation, it's temporary. Right. They haven't taken care of the biochemistry and the emotional component that are involved with this. They still don't even accept that yet. They're so far behind with accepting the fact that you can have physical pain brought on by emotional stress.
Right. To your point, just as an example, people don't realize under stress, for example, emotional stress, physical stress, how much your body rips through B vitamins, right? So your percent daily allowance that's on a bottle is meaningless, right? If you're suffering from certain ailments or diseases, or if you're a super highly trained athlete, or if you're super stressed out all the time, or even to that point, getting certain vitamins to cross the blood-brain barrier. Like there's very particular forms of B vitamins now, because B is a water-soluble vitamin that we can use that are fat-soluble that will get into the brain more effectively, which is important, like benfotiamine for alcoholics or other people that have had PTSD or certain issues that are going on. This is so well researched, and part of the approach that you're clearly taking that obviously goes under the radar so easy. You look at what these B vitamins do, and it's staggering how much. I'm just taking one section, right? I'm just taking one thing, for example, and it's staggering how much of a difference people can feel.
I'll tell you, one of the things I find amazing is people bring in their blood work all the time, and doctors are, you talk to your doctor, and a lot of times they'll say, you don't need a multivitamin, you don't need any supplements, you're fine, eat a fruit, eat a vegetable. But my God, they will never miss testing that vitamin D.
Yeah.
It's like, it's the holy grail of vitamins. Nothing else matters.
So to that point, right, people know that have watched my videos, MedCram put out, a host of studies on vitamin D for COVID and showed how effective vitamin D is, and that it really needs to be over 50 on your blood work, blah, blah, blah. And my biggest criticism, I went through 12 things that MedCram missed in this 1 hour thing about vitamin D. And one of the points I was making is that they're missing that sunlight itself is critical for nitric oxide production and getting it into your eyeballs. And sure enough, just last week, they put out a video saying vitamin D isn't enough, that the light itself matters. And to this point, when you're looking at isolated things on blood work, you also have to think about just evolutionarily and contextually. How did we get it? For example, vitamin D. We got it through the actual sunlight. And that proves to actually be super critical. But it is amazing how people like Dr. Schwalt on MedCram can literally miss this, right? Until they have the evidence. But the evidence has already been out there. When you look at vitamin D research, and they correct for vitamin D in the winter and the summer, in the northern hemisphere and southern hemisphere, you still see that even after correcting for the vitamin D, that you see an asymmetry in the mortality. So they know there's something else that's preserving people in the summer, whether it's northern or southern. And it turns out to be the sunlight itself.
Well, that brings up a really important part. Anytime you can do it naturally, the way it was done 100 years, 200 years, or 300 years ago, you're better off. I mean, I'd much rather my patients eat fruits, vegetables, whole grains, organic, natural foods than having to take nutritional supplements. But, one of the biggest problems we have is a lot of vitamin and nutritional companies are focusing on the one active ingredient that gives the most bang for the buck. But really, when you're using nutritional supplements, it's a entourage effect. CBD is an excellent example. People are like, well, I bought CBDs at the gas station and it really didn't work. Well, there's a lot of problems with that right there. I'm very big on using full formula CBD products, full spectrum CBD products for pain management. I think it's the greatest breakthrough that we've had in healthcare in probably 20 years. And the reason for it is that the research really shows. I'm going to go back to that in a second.
Yeah, and let's go, because I want to add a couple things to that.
So first thing is that when you take CBD, CBD is one of 50 different biochemical compounds, and really I'm being generous, there's like 200. Biochemical, terpenes, different subcategories of nutrients found in hemp products. CBG just happens to be the biggest one, so they name it. But when we recommend it, we always recommend a full spectrum. Everything, CBA, CBD, CBN, CBG, CBGA1, there's a whole bunch of them, because it's been shown over and over again that when you give the full entourage, it works dramatically better. And it's no different for the B vitamins, it's no different for vitamin E, it's no different. You need to take the full group like you would have gotten it in nature.
Yeah, just so people understand that something like vitamin E, there's actually different forms of vitamin E that you can take collectively. So that becomes one of the misnomers there. Like, to your point, it's not just vitamin E. There's Toca trials, right? I think they're called.
There's a number of them.
Yeah, and there's a number of them, and it's best to use a full spectrum of them.
Even vitamin C, you know, everybody knows ascorbic acid, but there are several other types in there also that when you take it, it just works better. So I would love to talk about CBD for a little bit.
Let's talk about, but here real quick, to your point about using full spectrum CBD and as sort of a method of pain management among other things. Are you familiar with, now they're showing that CBD along with low dose naltrexone has been even more effective. So low dose naltrexone as a form of pain management that has been around for a while with unbelievable, especially in gut dysbiosis, like Crohn's disease and whatnot. They're showing now that when you combine it with full spectrum CBD, that the outcome is precipitously better. To that point.
So low dose Natraxon is Narcan, what they give to take away the opioids from the nervous system. But you use 50 milligrams to detoxify somebody. Right. You use like 1 milligram or less as a low dose. And what they're finding is that it binds to the opioid receptors and helps manage the pain. And then you have the CBD coming in and actually being more effective for going in and reducing pain and balancing the mind. One of the reasons that CBD is so effective is, it's funny, people are like, I take CBD for my sleep, and another person says, I take CBD for my anxiety, another person says, well, I take CBD for my gut, and
or my pain, or my whatever.
Right, they come in, everybody's got a different story. And what they really don't understand is the beauty of CBD products, full spectrum CBD products, is that it's a true adaptogen. Right. So when you take it in, it brings your body back into balance. You have inflammation, it brings it down. You have stress, it brings it down. You have slow gut motility, it moves it up. It tries to balance out the body from the brain to the toe. Every cell has the ability to utilize CBD, full spectrum CBD, and every time it's taken into the body, it tries to bring it closer and closer to balance. And that's why it works so well for so many different people. Last year I went around the state lecturing to physicians. I think we lectured to 1,000 different doctors on how to properly use CBD. And some of the research that we were pulling out is, drug addicts found that like 70% of them found it helped them get off of drugs. 80% of people with fibromyalgia ranked it better than the medication they were taking. People with stress, anxiety found it knocked down their stress and anxiety better than the medication. Because medications try to control us. They try and push us in a direction. Right. And we're only guessing if it's bringing us into the right direction. But when you use an adaptogen like full spectrum CBD, it pulls you back into the middle. And that's always like where we're trying to do. When I treat a patient, we're trying to maximize function. Trying to maximize your physical function, your emotional function, and your biochemical function, so that you stay in the middle. You stay in that homeostasis where you're actually working the way you're supposed to be, where you can handle some physical stress, you can handle some emotional stress, where you can build and grow. And regular medicine doesn't do that. They just want to get rid of the pain, which is, admirable, but it's short term.